morning, Grace.
Good morning.
I'm Carolyn Rutledge, and I'm your nurse practitioner. And I just got notice that you needed to have a visit, a telehealth visit, because you've been having some abdominal pain. I would like for you to tell me a little bit about the stomach pain. How long have you been having the pain?
I've been having the pain in my stomach for about 2 days now.
About 2 days. And is it the same now as it was 2 days ago, or has it been getting worse or better?
It's about the same.
Okay, what about nausea and vomiting? Any nausea and vomiting with it?
I've vomited once and I've had quite a bit of diarrhea.
So how much diarrhea, how many times did you go yesterday?
About 4 times yesterday and once today.
And would you say it's pretty watery?
Yeah.
Yeah, okay. How would you describe the pain? Is it sharp shooting or dull?
It's aching pain, pretty tender.
Mainly, okay, good.
Here.
Have you had any fever?
No, I don't have a fever.
Okay. How much have you been able to eat and drink since you started having these symptoms?
No, I haven't really been able to eat much. I've had a few sips of ginger ale, that's about it.
And so that's probably been over the last 2 days, so not much fluids and...
Yeah, I haven't been that hungry at all.
Have you been around other people that have had similar symptoms, like classmates?
About 2 of my classmates, they've been sick with the same symptoms.
Same sort of symptoms, okay. Are you on any medications?
I am on birth control to regulate my period, but nothing else.
Okay, and have you missed any of your pills?
No, I've taken all of them.
Okay, and your periods have been regular?
Yeah.
Okay, well, good. Are there things that make the pain better or worse?
Mainly just sitting still and not moving has made it better.
Okay, so as long as you're not moving around, okay. Have you taken anything for the pain?
Pepto-Bismol, that's all I've taken to help my stomach.
Okay. And are you having any kind of chest pain?
No.
Okay. What about voiding? Any pain with voiding?
No, I don't. No, I haven't had any pain with that.
Any frequency, like going to the bathroom to void more frequently than usual?
No.
No back pain?
No.
Okay. Okay, Grace, I'm not able to do a typical exam with you since we're doing this through telehealth. So I am going to have you be my helper.
Okay.
I'm going to tell you what I need you to assess for me, and we'll take it from there.
Okay.
If you can move the camera back or sit away from the camera so I can see your belly.
Like this?
Okay. Yeah, where exactly is it hurting?
It's right here in the middle. Right here.
Okay, right there. Another thing I would like for you to do, I want you to stand up and jump up and down 3 times. And I want you to tell me how that makes your stomach feel. And you can sit down. Did that cause any pain, any difference in your pain, or
Is it
pretty much
somewhat,
but not a severe increase or anything?
No.
Had a fair amount of diarrhea. What I would like for you to do is hold your arm up, and I want you to pinch the skin like I'm doing, and then you sort of drop it down. Okay. Okay, good. And what I'm doing there, I'm checking for dehydration, and you look like you, at least right now, you're hydrated. You haven't lost that much as far as fluids go. I would also like for you to check your pulse. And what I would like for you to do with that is you take your wrist and you put your hand toward the thumb side, and it's just with these 2 fingers. And tell me if you can start feeling a beat there.
Yep. I can feel it.
I'm going to start timing you for 15 seconds, and I want you to count for me how many beats you're feeling.
Okay.
Okay. Ready?
Yep.
Go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23.
Okay. Okay, your pulse is within the normal rate. It's about 88, which may be a little bit higher than I would like, but not indicative of anything at this point. Have you noticed any extra rumbling in your belly?
Yes.
Okay, and that's probably happening right before you have diarrhea and all.
Oh, yeah.
So what I would like for you to do is reposition the camera or your iPad so that I can see the couch. And I want you to lay down on your back and bend your knees. And I'm going to have you feel around on your stomach with the tips of your fingers on your right hand. So if you can go on and lay back and we can get started. Okay, bend your knees and slide down so that you're lying flat. Slide a little bit further down. Okay, there you go. Okay, I want you to put your, is it any way I can get the camera tilted a little bit more?
Yeah, I can try.
Or even if it can be lowered a little, that would be great. Oh, that's much, much better. Perfect. Okay, lay flat. Okay, so you're going to take the ends of one of your hands and you want to feel all around your abdomen, and you're going to tell me where you have the most tenderness. Is it tender there?
Yeah, it's tender mostly in the middle.
Okay, and go to each side. Anything there?
No.
A little bit less pain there?
A little
okay,
bit less
come on.
pain.
Okay, come down a little bit lower. Okay, and move over to the other side. Okay, and then work your way back up. Okay, right there?
Yep, it's right here.
Okay. The next thing I want you to do is take your fingers, just like you have them, and I want you to go, you're on your right side, go down your right side to the lower part of your belly. And just wait a second. What I want you to do is push in there and hold it, then let off quickly and tell me if any of that hurts.
Okay.
Push down. Now let off. Any pain?
No, I don't have any pain.
And then do it on the other side.
I don't have any pain there either.
Okay. So it looks like it's pretty much generalized in the central area. Grace, I think we have a good handle on what's going on with you. There's a GI bug that's been going around, and not an insect type bug, but more of a virus, and people have been having a lot of the same symptoms that you are. It usually lasts about 4 or 5 days. What we need to do, our main concerns, one, are to help you from getting dehydrated and to also make you feel better. Some of the things that I would like to recommend is to make sure you continue drinking fluids as much as possible. Our biggest concern is we don't want you to become dehydrated. And so I want you to try to get in as much fluid as possible. And what you can do is you can pick up some Pedialyte, like with the young kids drink, because that has the electrolytes and we'll replace that. I want to put you on what we call a brat diet. And a brat diet, it stands for bananas, ripe bananas, rice, applesauce, and toast. And you'll probably find the toast right now will be the thing that you can tolerate the most.
Okay.
And so instead of going to a lot of harder foods and spicy foods, you're going to want to stay away from those for a little while. Then I'm also going to have you pick up something to help slow down the diarrhea. So hopefully within the next few days you'll be feeling a lot better. But, you know, as far as an appendicitis or some of the things we'd really be concerned about, I don't think we're dealing with any of that right now.
Okay.
I am going to send you a secure email that will list all the things that we have talked about. Maybe you can get someone to run out to the grocery store and pick up the Pedialyte and pick up some Imodium for you, and maybe the foods for the brat diet.
Okay.
So if you don't have any questions, I think we're good.
I don't have any questions.
And if your symptoms don't get better within the next 3 or 4 days, please contact us again.
Okay.
Take
Thank
care.
you.
All right, bye.